Let's clean you real quick. So I'm gonna just clean your skin with a little bit of alcohol just to make sure there's no makeup. And we'll do a little bit in the neck. So we're gonna do something called a YAG facial, or just a YAG treatment for wrinkles. YAG is a 1064 wavelength. So that's 1064 nanometers. So we're going to do a YAG facial, 1064 wavelength. The YAG laser targets water molecules in the tissue. It heats up that water content, and we're able to create some low-grade inflammation, which is nice because then the patient doesn't have downtime. Low-grade inflammation to stimulate collagen and elastin. Also, YAG has a higher affinity for hemoglobin. So it can also help with some rosacea patients, some redness, and vascular lesions. But the main thing is stimulating collagen, helping with skin tightening when you're dealing with YAG. What's also great about YAG, other than no downtime, is that you can use this on any skin type. So it doesn't matter what skin complexion you have, you can do this treatment. So I'm really excited to do this for you. I'm going to just calibrate here. And this is a very comfortable treatment. We're gonna do 3 or 4 passes in each area. And what we're gonna expect to see is maybe some mild redness, and that's about it. So what I could do is I can even start from your neck. I'm gonna give you a little zap. You don't feel anything, right? Very light. So we can just kind of move up and down here. And just kind of, do you feel any kind of, a little bit of warmth?
Yes.
Perfect. So just want it to be a little warm. Some you can start to see a little bit of redness. And then we can go back over the area. The most important thing is you don't want to heat up the tissue too much. So it's good to avoid numbing the patient in these situations so they can tell you if they're feeling something, okay? I want them to let me know if they feel any discomfort so that we can, you know, adjust the treatment settings if we need to. Is it still feeling warm, or it's okay? A little bit? Okay. Very good. Let's go to this side. Another treatment that's similar to this one is going to be Sublime. In Sublime, we can also heat up the tissue. It's infrared with radio frequency. So you can see not much happening on the surface, but you are creating some inflammation under the skin. So how does that feel? A little bit of redness you could see in here as well. How does it feel?
Just warm.
Warm. So now we're gonna just go ahead and start with the face. How's that?
Comfortable.
Okay.
Little warm.
Very good.
Not hot.
Good. So it goes from warm to hot very quickly. We just wanna kind of continue to move along. If the skin gets too hot, you can cause a burn in the skin. And that's not, we're not trying to create any burns, because burns lead to blisters, and blisters can definitely lead to scarring. So you could see that mild erythema. It's exactly what we want to do. Help with increasing blood flow to the area as well. Okay, perfect. I can do a little bit on the forehead, and then I can go to the other side as well. And if you're an area that has thinner skin, you might do less passes because you're heating up that tissue a lot faster. And so if you have the patience, then, and you don't have the downtime, because, you know, you're constantly interacting with people, you know, some people work from home, they're not doing Zoom meetings, they're not interacting with anybody on a regular basis. So they have downtime to do things like a CO2 treatment. But if you don't, you're constantly in front of people and you can't have, you know, too many days of downtime, or maybe you work outdoors, you spend a lot of time outside as part of your work or your hobbies, then again, there's treatments that you want to take into consideration that you won't be able to do. You want to make sure that the patient's lifestyle fits the treatment that you're going to offer them, and that they're going to be able to follow those instructions after the treatment. Otherwise, they're going to end up with some side effects. And this is called kind of like a painting technique, where you're just kind of painting the face with the laser. So very good. Just you see this mild patchy redness, and it's already resolved in some areas where we've completed the treatment. So this side's still a little bit red, but this side you could see is almost completely resolved. So the downtime's pretty minimal. You do want to do these treatments 2 to 4 weeks apart. Just wear sunscreen, and you can use all your usual skincare routine. All right, are we ready to do some threads?
Yes.
Okay.